5%. Like you rightly put it yesterday, we did see 5 new positive cases coming through. Today we'll get an update on what is happening in as far as the COVID-19 is concerned and get more educated on the compliance and prevention measures that have been put in place, like you were discussing in studio. But for now, I hand you over to the Minister of Health, Dr. Chitabu Chilupia, who is joined by his permanent secretaries and Professor Roy so that he can give us the update.
Good morning, good afternoon, countrymen, and good morning, countrymen and women, and members of the press. We acknowledge today the presence of the two permanent secretaries in the Ministry of Health and our lead infection diseases specialist, Professor Lloyd Mulenga. We acknowledge too the presence of our public health guru, an internationally acclaimed Professor of Public Health, Professor Babu. We welcome all of you to today's update. We mourn the passing on of our young, dedicated, gallant soldier, Ian Mutambo, who passed on in a tragic traffic accident while on duty. The investigation is already begun to establish the facts on the ground and to see why there was a deviation from the system that has been set up for COVID-19. The Provincial Health Director is working with colleagues in the province and being supervised closely by my office to ensure that we establish the full facts that led to, one, the accident where we lost 4 citizens, including our gallant health worker, and 2, what happened as to the circumstances of the transportation of the COVID-19 sample on the bus. We will revert to the public. I urge the public, media, bloggers, to allow the family the privacy and the peace to mourn the departed, and ensure that all of us give the family the full support. Government will fully support the family to ensure that we put to rest our gallant departed hero. Our fallen hero will be put to rest at a date to be announced very soon by the family, and as we speak, government is working closely with all the stakeholders to ensure that the burial is done in a dignified manner befitting the status of the fallen hero. His Excellency, the President of the Republic of Zambia, Dr. Edgar Chagolungu, is deeply concerned with what transpired and has directed a full investigation. And I want to assure the public that this investigation has commenced, and we will leave no stone unturned to ensure that all the facts are put on the table. In the meantime, let us respect the family and allow them the privacy and dignity to mourn the departed. It is a dark cloud over the medical fraternity. A loss of a soldier at the front line in a public health war is devastating, and we are all devastated by this loss. So we want to hold hands in solidarity and mourn the fallen hero in the dignified manner that he deserves. To stem the progression of COVID-19 outbreak in our country, the government of His Excellency President Edgar Lungu continues to trace contacts to all positive cases, to follow up alerts and those at risk in health facilities. And we are also expanding our quarantine facilities and ensuring that community spread is avoided. The strategy remains active case finding through surveillance, which is based at our hospitals or health centers, through community-based surveillance, and through surveillance at our ports of entry. Active case finding is critical, and management of these cases is fundamental. We are engaged in active contact tracing to ensure that all the contacts of the positive cases are traced, and if found positive, are equally quarantined. To ensure that we meet the objective of picking out all the positives and putting them away, to ensure that they recover without infecting others, we are scaling up our ability to test. Our laboratory capacity has been upscaled, and the numbers that we are reporting in terms of the figures, in terms of the tests done in a day, are going up. Yesterday, we carried out 926 tests. That was a statement of intent to scale up the laboratory capacity. We continue with the mass screening, targeted testing, and the surveillance at all points. We, in the last 24 hours, did conduct 811 tests. And out of these 811 tests, we did record 13 new cases of COVID-19. And that brings the number of cumulative cases to 137, including 3 deaths. The cases include 9 contacts to known cases, 4 of whom are health workers from Chilenge who did not participate in the initial screening because they were not available at that particular time. They were away, and as they came back, we subjected them to the screening that their colleagues did, and these 4 health workers did test positive. 3 were detected through health facility screening, and 1 through the mass screening exercise in Lusaka. All the new positive cases are adults and are admitted to our various isolation facilities in Lusaka. The number of active cases is therefore 59, with 52 in Lusaka and 6 on the Copper Belt and 1 in Kabwe. All the patients are stable, and today we have not discharged any patient. Therefore, the number of recoveries from the time the outbreak began remains at 78. It is important to note that the team that is doing case management in the isolation facilities is doing a fabulous job. Today, I was privileged with my permanent secretaries to have a Zoom conversation with a team that is managing patients at the front line, and they give wonderful testimonies. They are in high spirits, they are working at the battlefront line, and they are ready to serve. They are committed, and they remain passionate about the cause. They are pledging to the people of Zambia their willingness and patriotism to serve. Dr. Masua, who was leading the conversation, did run us through the success stories and did emphasize the support, the patriotism, the willingness of the team at the front line to continue with the struggle. Today, they reported from the front line, as they showed us a few pictures through Zoom technology, that the 3-month-old baby came in with a temperature of 40 degrees Celsius, had respiratory difficulties, had to be put on oxygen, had to be screened for various pathogens, and they had to change regimen of drugs several times in consultation with their senior colleagues who are available through technology. Professor Mlenga, Dr. Makupe, and team of other senior specialists in pediatrics. Today, they were very proud to report that the 3-month-old baby is very stable, off oxygen, and breastfeeding, temperature normal, and they are just waiting for a second negative before they free the child. And they are in high spirits because of such good success stories. We urged them on, and on behalf of the President and the people of Zambia, pledged our full support and our protection as they are doing their trade at the front line. So join me in appreciating our gallant soldiers at the front line. Distinguished ladies and gentlemen, the 14-day mandatory quarantine is still in effect, and everybody who comes into the country will have to be mandatorily quarantined for 14 days. So 3,310 persons have successfully completed the 14-day quarantine, and a total of 1,423 alerts have been responded to and cleared as non-cases. We continue to applaud the community for this patriotism. If we look at the global level, we have crossed 3.5 million mark, and we report 3,566,330 cases with 248,286 deaths. On a positive note, 1,154,072 cases have recovered. This is happening in 212 countries and 2 conveyances. Back home in Africa, 15,146 people have recovered from COVID-19, while 1,802 have died. This is out of a total number of 45,466 cases that have been recorded. Zambia is a member of the Southern Africa Development Coordinating Committee, SADC, and is representing the region at the Africa Center for Disease Control. So today, we report from the hub 8,413 cases with 194 deaths and 2,941 recoveries. Distinguished ladies and gentlemen, COVID-19 requires that we test citizens to ascertain the extent of the challenge in the country. We have expanded our capacity to do laboratory testing. The numbers of the last 2 days betray our intention. 926 yesterday, unprecedented. 811 today, unprecedented. And as the number of cases that we test on a daily basis increase, you expect, like I have alluded to previously, that the numbers of cases will go up. In other words, we are in the surge phase. We are in the surge phase, and all the people that shall be found positive shall be mandatorily quarantined and treated. When they recover, they'll be discharged into society, reintegrated into society. But as they get back into society, let me caution against the fear and anxiety amongst these persons in their communities. This may fuel stigma and stereotyping of individuals that have recovered or suspected of COVID-19. Stigma undermines social cohesion, discriminating against and excluding people from participating in a number of different areas of society. Stigma poses a real threat to the effectiveness of our response. Therefore, the current response to the pandemic should not be allowed to provoke social stigma and discriminatory behaviors. His Excellency President Edgar Chagwa emphasizes the need for Zambians to love one another. So as we practice physical distancing, let us maintain our Ubuntu spirit. Our Ubuntu spirit. We're passing through difficult times, and let us not abuse the principles that we have put in the guidelines to combat COVID-19. Distinguished ladies and gentlemen, as we forge on in the fight against COVID-19, let us be cognizant of the measures stipulated through the Public Health Act, Cap 295, and Statutory Instruments 21 and 22 of 2020, and even superior, the pronouncements that His Excellency, the President of the Republic of Zambia, Dr. Edgar Chagwa has made. And I run through this and emphasize no public gatherings. I take this opportunity to express disappointment with the manner in which a few congregations conducted themselves last weekend, and it had to take our vigilant public health officers to ensure that physical distancing was enhanced. Let us not abuse the opportunity we have to congregate in line with the regulations, guidelines, and certification. This is supposed to be respected mutually. So for those who breach these guidelines and regulations, I have a message to them. You are putting the people in your congregation at risk, and you are putting the communities where your congregants come from at risk, and you are putting the whole nation at risk. And we will not allow you to proceed in that manner. The guidelines were very clear, were consistent, and must be adhered to. This is all to ensure that we protect the nation from public health hazard called COVID from flaring up. Let us avoid public gatherings. Let us uphold personal hygiene practices, and let us ensure the environment we're serving is clean. Always and always put on a mask in public. And when you see any suspects, however close you are, notify to the authorities that there is such a suspect. It saves millions of lives. Together, we will win this fight if we exhibit collective responsibility, collective discipline. We want to thank the Jesuit community at provincial level who have partnered with government and made an appeal that resonates in terms of the pillars they are focusing on with the functions, with the strategy that government has mounted against COVID-19. We thank the Jesuit community for that initiative and urge all to emulate them. We continue to appreciate the media for your support as you continue celebrating your World Press Freedom Day. Let us continue to practice what is emphasized in the Public Health Act. Avoid gatherings, escalate your personal hygiene and environmental hygiene, mask up, notify suspected cases, practice physical distancing. May God bless Zambia.
afternoon. Yes, from KBNC. Honorable Minister, that Zambia continues to report new COVID-19 cases. I want to find out how our research team, how far the research team have gone, and if Zambia is considering to get some cure from coronavirus. Thank you.
Thank you very much for the opportunity. The name is MoH from Time and Television. Honourable Minister, I'd like to primarily state that in line with the World Health Organization guidelines for safe transportation of infectious substances and diagnostic specimens, including the HPCZ scope of practice for biomedical scientists. The case of Ian Mutambo, which I'd like to draw your attention to, is a clear act of negligence. And it does not only breach those practices, but it also puts the general public at large at risk. I'd like to find out, Honourable Minister, shouldn't you be taking punitive actions, considering the fact that this particular negligence, in my opinion, merits even your resignation? Allow me to qualify my submission, Honourable Minister, without malice. A report by the Zambia National Public Health Institute dated January 20th, 2020, in part 3, under subheading Challenges and Gaps, highlighted the lack of vehicles, fuel, and in particular sample transportation. Why was this not addressed? It wasn't. And also, Honourable Minister, transportation of specimen by local service transport requires approval and certification. I'd like to find out from you, was Power Tools certified by HPCZ? And lastly, the handlers of the specimen on the bus, including conductors, were not wearing PPEs as per requirement. The documents I was referring to, Honourable Minister, are right in my hands. Thank you very much for the opportunity.
Do you have any other questions before we give an opportunity to Honourable Minister to respond? Any other? Honourable Minister, you can give responses to those questions that
Well, thank you very much. The second questioner was so passionate that he eclipsed my memory of the first question. The first question focused on
first question was on research and possibilities, whether thinking of bringing in the releases that have been discovered in Madagascar.
Well, I'll continue emphasizing the need for us to have evidence to inform practice. We will practice, we will be informed in our decision making by evidence. Therefore, we have heard reports of 20 observations of positive patients who have recovered in Madagascar using the famous drug that Madagascar says has efficacy. However, we are also conscious that there are no trials that have been done, but we do know, as you know, Zambia is a malaria endemic country, that the drug they are using, or the drug that is being talked about, is derived from Artemisia, and it is containing one of the antimalarial ingredients called artemisinin. Now, what we are doing as a way forward is to engage our colleagues in the Madagascar research team so that pertinent questions would be answered. And once we adduce adequate information, a basis for decision making, that decision shall be made, and we will be able to make decisions going forward. The next question focused on the transportation of the samples, and I've seen that on social media there are insinuations about so many samples that were being transported and so many samples lost and so on and so forth. Let me set the record straight. One, there was one sample, and that sample was packaged in line with internationally recommended recommendations or criteria, and that means a triple layered packaging. A triple layered packaging does not put the transporter or the passengers at risk. The sample was recovered intact, and the sample is being processed in Ndola. So there is no loss of sample, and the packaging was in line with international practice. We do a triple layer packaging, and that does not put at risk the courier or the people on the conveyors. That should be made extremely clear. I will reiterate what I said earlier on, that investigations into this highly very unfortunate incident are ongoing. We are all suffering from one problem. We are at pains. We have pain. We are all distressed at the loss of a young warrior at the front line. Young Ian Mutambo's death has caused a lot of pain in all of us, and we will not give you information that is inaccurate. We will not justify anything. We will investigate thoroughly and get back to the public with facts. We will draw no benefit in issuing information or issuing data that is inaccurate. So we request that we all hold hands and mourn the fallen hero and ensure that we give him a befitting departure, and we support the family in this very difficult time and avoid speculation, as our teams are on the ground, our sectoral teams are on the ground to decipher the facts. And in the true spirit of transparency, we will communicate to the public. Let this not be used as a platform for politicking. Let this not be used as a platform to settle scores. Neither should it be used as an opportunity to reverse the gains in the COVID-19. We have a brave warrior who we have lost at the front line, and we are all in mourning and very distressed at this. Allow all of us to wait patiently for the investigation outcomes, and we will communicate to the public information that is accurate and in a transparent manner. Therefore, let us give the peace and dignity to the family as they mourn, and let us allow this young hero to be buried with the dignity that he deserves. All patriots and all well-deserving, all well-meaning Zambians today should be in mourning and hold hands as we bid farewell to this young fellow. And for those who see this as an opportunity to pour scorn on the response, it is extremely unfortunate, and it is not an appropriate opportunity. For now, we will remain focused, and to respect the legacy of the young man, will continue to push on and ensure that we fight and defeat COVID-19.
Thank you so much, Honorable, for those responses to those questions. Do we
Well, I'll seek your indulgence to understand that the investigation is ongoing. And, I'll seek your indulgence that we wait patiently for the report to come out. And let us, at this particular time, all hold hands as we grieve the loss of this young hero. And we do not want to destroy the mood of mourning that we all are in. And like I said, we will find no value in hiding any information. That's why the team that has been set up has already begun works, and we will get a full report that shall be shared with the public. That is my response.
Thank you, Honorable Minister. Do you have any other questions that can take another round of questions before we proceed with the program? Okay, seeing none, Honorable Minister, continue having support from our well-wishers who come to join in the fight against COVID. Today we have one donor in the name of Outnet, and the group chairman has come to actually, I think, make a statement. So I'll call upon the group chairman of Outnet Marketing to come forth and issue a statement. Good morning, Honorable Minister.
Good morning.
My name is David Combe, and I'm the group chair for Outnet Marketing, which is part of the Root Holdings, a Zambian-owned entity. Honorable Minister, as a citizen of this country, and our firm being a purely Zambian-owned firm, we believe that it's our responsibility as a people to participate and support government in the effort to fight the COVID-19. This fight, Honorable Minister, cannot be left to the government alone, because we understand that resources are not adequate, and therefore each and every one of us in the private sector should come forward to help you in this effort. But most important, Honorable Minister, as Zambians, I think it's time we realize that this is our fight, and we cannot sit back to wait for people from international countries or other places to come and fight for us. Suffice to say that all the other countries are also fighting their own battles. So if we don't stand up as Zambians and we don't take the lead in this fight, the chances are that we'll lose the fight on our own. So we come here today, Honorable Minister, as Zambians to demonstrate that we must take the lead in this fight and not allow or wait for international funding to come through. In this vein, Honorable Minister, our company today would like to donate to the ministry 100 bales of Essence toilet tissues and 50 bales of Essence kitchen towels. We realize that you have set up quarantine centers and isolation centers, and also you have places where you are keeping the patients, and these products are required in these centers. So we are donating them for onward distribution to these centers so that our people can be comfortable in those areas. And for the kitchen towels, our personnel in the front line can use them as they wash their hands in serving our patients. Honorable Minister, we applaud your efforts as government, and we just hope that this war will be won and this epidemic will come to an end soon. Because we all understand the negative economic impact it has on our businesses. We are already feeling it, and that will continue even post the COVID-19. So we are anxious as business that was ultimate donating $100 kitchen towels. Honorable Minister, that was the only donor we had this afternoon. Now I call upon you to
I would like to urge all of us who are in quarantine in government-designated facilities to adhere to the rules and guidelines in place. It is for your safety, it's for the safety of the nation. I would like to appeal to all those who are returning home or are transiting to adhere to the guidelines. Our surveillance is alert, and yesterday, yes, we did report that we notified a truck driver. Well, it means that the number of truck drivers notified in the last few days has gone up to 5. Yesterday, we notified another Namibian truck driver, and he's being quarantined and being treated on the Copper Belt. We will continue to be alert in our borders, and we urge all of you, frontline health workers, to continue being alert in your facilities as you deal with everyone and do not discriminate against everyone. The principle of universal health coverage that President Lungu pursues is leaving no one behind and ensuring that we do not discriminate against anybody. So we support the truck drivers in transit, we support the citizens who become symptomatic, and we support the returning citizens, and treat everybody the same without discrimination or stigma. That is a fundamental principle in our response. And remember, it is in alignment with the SADC protocol and also the continental response to COVID-19. Allow me to again express the importance of us adhering to the many measures in the community that will help us to prevent contracting COVID-19. Washing your hands is key, putting on a mask is essential, staying home and avoiding interaction with possible sources is key, and ensure that public gatherings are avoided. And for those of you who may need to congregate, you need to be certified by the Zambia National Public Health Institute. And should there be non-adherence, we will not certify. Even if we certify, we will withdraw certification. We emphasize that the Public Health Act will reign supreme as we assess your ability. And I emphasize that for those that were found to be in breach last weekend, we would like to warn you to align and ensure that you do not put the congregants and the communities where they come from at risk. Let us ensure again that we support the frontline health workers as they do their work. Let us ensure that through solidarity, we leverage resources and ensure that there's adequate PPEs at the front line. Let us ensure that these supplies are available. To this effect, I'd like to thank all the cooperating partners that have come on board to promote this fight. And today, the Jesuit Society, the Jesuit community have shown leadership and partnered with government, making a broad appeal for support in the COVID-19 response, enhancing sensitization, advocating and mobilizing PPEs, distributing foodstuffs to our frontline health workers, and so far they've already done it in 3 places of the COVID centers in Lusaka, enhancing information to the public through their TV station and other media platforms. This is as it should be. We'd like to thank all the other cooperating partners, the Association of the Indian Communities in Zambia, Trade Kings. We appreciate all the other banks, all the banks that have come here, the institutions such as public unions that have come on board to hold hands with government in expression of solidarity. The Biomedical Union of Zambia is particularly picked out as we mourn together the passing of our young man. We also want to emphasize our prioritization of research as we combat COVID-19. Many research questions have been generated as we are adducing evidence to support our response to COVID-19. It is important to note that as we work to provide this response, we are working with our partners globally and locally to generate adequate evidence to inform strategic policy direction. So we are participating in some clinical trials, and we are participating in various research activities that will help us answer key questions. We are doing some work with the World Health Organization, with the Johns Hopkins University soon, and many other stakeholders on clinical trials. We are working with various stakeholders locally and abroad on genomics to understand what factors are involved when it comes to the severity or to the morbidity and mortality of COVID-19. We're working with various stakeholders to do a prevalence survey and also ensuring that we come up with key variables such as that important metric of the numbers who are positive, determining the extent of the disease, so that could inform how we reopen cautiously various aspects of our lives. Remember that the principle that His Excellency President Lungu has emphasized is the delicate balance between avoiding hunger and poverty and ensuring we do not have a public health crisis. That continues to be our guiding principle. We'll continue mass screening. In various communities. I want to thank the community for the tremendous support that they have given. And with the increased capacity to test, we will ensure that we're even more efficient in giving you results. I also want to inform the people of Nakonde that we will give them the full support. Today, the Honorable Minister of Nakonde will launch the mass screening and targeted testing in Nakonde to establish the extent of the challenge in Nakonde, and we'll give you all the support as you do that. We continue to mourn the passing of Ian Mutambo, and let us continue in solidarity and in unity of purpose to hold hands and give our departed hero a decent burial, decent funeral, and let us continue supporting the family and patiently wait for outcomes of the investigations. We share in the pain and the grief that the whole nation is, and let us quarantine politics as we do all this. 13 new cases, 137 cases in total, 3 deaths, 78 recoveries. And we have under our care 59 cases that are being managed in Lusaka on the Copper Belt, 52 in Lusaka, and 7 on the Copper Belt. We thank you for listening today.